So one of your main focuses, unfilled hours of the doctor and the hygiene department.
Correct.
So what do you do here?
Well, I'm looking to see what of available time for patients, how much is unfilled, because that's lost opportunity. And that number helps to make important decisions about, do we hire additional staff? Do we bring on an associate dentist? Do I add days of hygiene? And too often those decisions are made without looking at this very, very important number. So for instance, I had a doctor who said, I'm really considering bringing on an associate dentist. Think the time is right. This will help me in the next 5 to 7 years transition out of my practice. And when we looked at unfilled hours, doctor unfilled hours alone, I said, doctor, you can't afford to bring on an associate because you have more supply than you do demand, if you want to look at it that way. So if you're 32 patient contact hours a week, you've got only 21 that are filled. What would feed another doctor? And
They don't know those numbers?
they don't.
Usually?
Usually don't. What they know
But they
is
go,
that-
I'm busy.
That's it exactly. Or they have a gut feeling, things are kind of slow.
They have a gut feeling.
Yeah, and I'm not
But they
a
don't know the
gut
number
feeling
on that.
consultant.
Okay.
No, I always want to quantify because I have a huge, in my opinion, responsibility and obligation to the doctor that hires me to say my recommendations are based on factual data, on numbers, not a gut feeling. It feels a little slower, it's gotten busy.
So 25 years into this, when you
Yes.
meet a practice, where are they normally when they're sluggish? And where do you want them to be?
Where I want them to be for doctors is less than 7% unfilled hours, hygiene less than 10%. And that number has actually gone up a little bit. What I usually see are numbers that are well over 15%. And as you can imagine, here's the conundrum. You have got, let's say, 32 patient contact hours that you're paying the overhead on. You've got full staff there, lights are on, everything's going, but you don't have 32 hours of revenue. And oftentimes when the doctors can see that, they say, oh, this goes beyond my gut feeling because I can quantify it. So would you rather have 32 hours of productive treatment filled to your 32 hours of expense, or would you rather have 21 hours filled, but you still have 32 hours of expense?
So you implement protocol systems, sales systems to get those people in the door.
Right.
Or what?
And to get people in the door, but in a productive fashion. So
Okay.
for instance, the goal is not to say, let's fill the chairs. I don't go by the chairs are full, it all must be good. How do we fill that productively? So how do you help to increase treatment acceptance so that patients are saying, yes, I want to have this treatment done. They're coming in, they're not only having it done, but they're paying for it. So I don't want to just see chairs that are filled. I want to see them that they're filled productively. And I have a number of methods that I use to quickly get practices moving in that direction.
Do you ever go into a practice and, whether you say it or not, but in your head you go, they're doing it all wrong?
Well,
Or they've got big flaws in how they're doing this?
It's funny. I think my perspective is not that they're doing it all wrong. Maybe I need to get a hobby, but I get almost giddy because I see the tremendous potential.
That you can help them.
Yes, and that's what I get excited about digging into.
So when you see them doing things that are really, they could be more effective, you go, this is good news, I could help them.
Yes, let me give you an example. I met with a doctor. I was meeting with him in his office over his lunch break. I got there a little bit early. He wasn't quite ready. So I sat in the reception area, and I almost felt like I was being punked because this was so amazing to me. The woman at the front desk, the hygienist escorted out her last patient in the morning, older gentleman, and he said to the woman at the front desk, he said, I owe you $800 and I want to pay for that today. And he had his credit card out, and she's looking at the computer, one with the computer monitor, not looking at the patient. So that right there concerned me. But this was the big concern. She said to him, you just have to pay $400 today. Don't worry about the full $800. You can pay $400 today and $400 later. And I'm thinking to myself,
Wow.
my goodness, people are offering you money and you're not accepting it. So, some of these things are simple corrects. Others take a little more training or working on how communication skills go with team members and doctors. But that's where I just sat there thinking I could bring such great results to this practice very, very quickly. And in fact, I have.